My name is Professor Mushtaq, and I'm a consultant paediatric urologist. I've been working now here in Great Ormond Street for more than 20 years as a consultant, actually. Well, that's an interesting question. I'm probably a lot older than maybe you think I am, and I grew up as a young person in the 70s and 80s. My family came from Pakistan with my three sisters. I was born here in the UK. And in the 70s and 80s, if you're the children of an Asian background family, the best thing that you could be was a doctor. Everybody wanted their children to become doctors because that was considered to be the best profession, really, for young people in those days. So really, it was my parents' wish for me to become a doctor. I never really thought twice about it. I studied extremely hard. I didn't go to a very good school at all. But I worked really hard and I got the grades and I went to medical school. So it was my parents' wish, and there's never been a day that I've regretted that they encouraged me to become a doctor. I became a pediatric surgeon really from when the time I sort of left university. I remember being in my pediatric surgery attachment in the fourth year of medical school. And I remember one evening, I was working with the senior consultant and he was going to operate on a newborn baby that had a condition called a diaphragmatic hernia. And in those days, children with diaphragmatic hernias underwent urgent surgery. And this was like close to midnight. And this doctor was going to operate on this baby and save its life. And I thought that was just the most incredible thing I had ever seen. And I thought, you know, to save a newborn child's life, to give that child the opportunity of life and all the emotions surrounding it for the family was to me the most rewarding thing that anyone could do in medicine. And I decided at that point to become a pediatric surgeon. So then I went on and I did adult surgery, then I trained in pediatric surgery, and then ultimately I came to work here in Great Ormond Street in the final year of my training. And it was actually other people who chose this path for me. The senior consultants here said, look, you know, we think you've got a lot of good technical ability, and, you know, we think that you should become a consultant here in Great Ormond Street. So it was not something I had planned. It was not something I imagined, but life turned out the way it has. And again, you know, it's been the most wonderful 20 years, hopefully another 10, 15 years more to go. There's never a day that I ever regret choosing this specialty and choosing to work here in Great Ormond Street. It's been the most wonderful experience. I guess the most rewarding part for me, there are several aspects of what's rewarding. Of course, the interactions with the parents, the interactions with the children. The children are just the most incredible patients to help and to treat because they're instinctive. They don't have any barriers. And when they're happy, they're happy. And when they're sad, they're sad. But they're so resilient. And, you know, you can undertake the most major surgeries lasting 8 hours, 10 hours sometimes. You see the patient the next day and they're smiling at you. They are the best patients in the world to treat. But I think what I love about my job is that I'm not just treating the patient alone. I'm also treating the mother, the father, sometimes even the grandparents. And that interaction with the entire family is just so rewarding. Technically, the surgery is very, very challenging. But you know what's been particularly special for me is that I don't just treat people and children here in the UK. My career has taken me all around the world, and I treat patients really from every corner of the world. I've had the opportunity to train other surgeons from around the world. So yeah, there's never a dull day. There's never a day that I think I don't want to come to work. Every day it's a pleasure to come and do the work that I am doing. What my patients tell me that they value about me is, I guess, a few things. Primarily, I think they value my honesty and my humanity. Um, Humanity is something that somebody very close to me told me about a long time ago. And that person said to me, it doesn't matter who you become, how big a doctor you become, never forget to be a good human being. So I always try hard to give my patients and my parents and the families that come and see me the respect and dignity which I think they deserve. So I always try and be respectful. I try and give them as much time as they need. Some parents need a small amount of time. They need a quick explanation. Some require a lot more explanation. But I think humanity and that sort of human connection is, I think, something which the families, I think, feel they value in me, that they can communicate with me on a one-to-one level. I'm not the big professor up there and they're down here. We are all human beings. So I think that is something really important. And the other thing that I've always tried hard to be is always be honest with my patients. And I think that they do value that, because some doctors tend not to be honest and they tend to not, be entirely clear with their patients. But, I am very good at what I do, but there are some things which I don't do. And if I don't do them, I tell the patient I don't do this, or actually, I don't feel comfortable to do this. So I'm always honest and sincere. And if things go wrong, which they often do, if when you're doing complicated surgery, sometimes things do not turn out the way they do. Again, I'm just honest with them and say, look, we've tried our best, but sometimes things just don't work out right. The majority of the time they do, but when they don't, just be open and be honest. I train a lot of doctors from all over the world, and the one thing that I always teach them, and I think is my mantra, is a word called conviction, and I think it's a very misunderstood term. And to me, conviction is doing something with confidence, but that confidence comes from your ability, your good ability, and from your experience. And I've been fortunate enough again to have been given good technical ability. It was something I was born with, and I really value that I was given that gift, and I have gained a vast amount of experience in the last 20 years of treating children with urological problems. So when I do things, when I see a patient, whether it's in the outpatient clinic, I can explain to families what is the problem with conviction. When I undertake surgery, certain steps, I undertake it with conviction, which means I do it with confidence, but not with overconfidence. Confidence that comes from the abilities I've been given, but combined with the experience I've gained over the years. So that is my mantra. And I tell that to all the fellows: when you do things, draw from your ability, draw from your experience, and execute it with conviction.